Good afternoon, everybody. I thought I'd begin by providing a brief update on the COVID-19 case in South Korea with links to New Zealand. Health officials have had a very valuable exchange of information with South Korean counterparts over this case, and that work is continuing. It's important to emphasise at the beginning there is no evidence of any transmission in New Zealand that involves this case. The individual left New Zealand from Christchurch on the 21st of July and arrived in South Korea on the 22nd of July after transiting through Singapore. The traveller had no symptoms but returned a positive test on arrival. I'm advised that the test was a rapid test, which is recognised as less reliable than the PCR tests that we do here in New Zealand. After leaving Christchurch, they spent 14 hours and 20 minutes in the transit lounge at Changi Airport, along with travellers from other parts of the world. Officials are currently seeking information from South Korea about a second test for the individual concerned. As we said yesterday, other causes, including infection in New Zealand, can't be ruled out at this point, so we have initiated a number of domestic actions out of an abundance of caution. These include prioritised contact tracing of passengers in the 2 rows around the traveller when they flew from Auckland to Christchurch on flight NZ 555 on the 20th of July. These are individuals who'd be considered to be close contacts should the case be found to have been infectious whilst in New Zealand. These passengers are being asked to self-isolate and to undergo testing. Contact is also being made with any other passengers on the flight. These passengers are not considered to be close contacts. They will not be required to self-isolate or to undergo testing. They'll be provided with health information and how they can seek further advice from their GP or from Healthline should they have any reason to become concerned. 5 household contacts of the traveller that the traveller lived with whilst they were in Auckland have also been contacted. All of these people are well. However, as they are considered to be close contacts, they are now in self-isolation and they will be tested today. As a precaution, we're also undertaking further public health inquiries into the individual's movements over the past month whilst in New Zealand. At this point, the risk to public health is considered to be low. We want to thank the individual and their household contacts for the detailed information they've provided us to date. And I want to emphasise that our work around this case in recent days has reinforced the need for people to track their movements so that we can contact them swiftly should contact tracing become necessary. And as always, the basic health measures that everybody can take still apply. Stay home if you're sick, wash your hands frequently, and engage in good cough and sneeze etiquette. If anyone has any concern about their health as a result of today's update, they can call Healthline on 0800 358 5453. On another matter, in recent days there's also been a series of questions around the safety of staff working in managed isolation and quarantine facilities. There are well-established and robust systems and processes in place at all of our facilities to keep everybody working there, their families and their close contacts and their communities safe. The Ministry reviewed health services and the infection prevention and control in managed isolation facilities back in June and developed a national set of MIQ health standards as part of that work. 2 weeks ago, I asked the Ministry to set up an independent review of infection prevention and control, and that is currently being undertaken by independent experts in the field. Each facility will be reviewed, and the findings of those reviews shared with those facilities and with the Ministry. After that work has been completed, ongoing monitoring will continue to be undertaken by HealthCert, and that work will begin in August. Questions have been particularly raised about the risk to nurses working in managed isolation and quarantine. Nurses and other medical staff are trained professionals, well versed in infection prevention and control, and particularly in the COVID-19 context, but there is no room for complacency. From Saturday, District health boards will take over the delivery of health services in managed isolation and quarantine facilities. These services are currently being provided by contractors. I expect the DHBs to employ dedicated workforces in those facilities, even if they rotate them in and out for periods of time. Where anyone working in a managed isolation or a quarantine facility subsequently works in a different role, I expect them to adhere to a stand-down period, similar to the one air crew returning from overseas follow, when they're stood down for 48 hours and must return a negative test. Within the managed isolation and quarantine facilities, nurses and other staff have access to appropriate PPE. They follow sound personal hygiene practices and they keep to physical distancing requirements. They also have regular health checks and they're regularly offered tests for COVID-19 even if they are not displaying symptoms. All those working in managed isolation and quarantine facilities and at the border are expected to keep detailed records of their close contacts, including their activities outside of work hours, so that if contact tracing is required at any point in the future, it can be undertaken as quickly as possible. This is, of course, what we are asking all members of the public to do, but I've asked the Ministry of Health to check particularly that those protocols are being very vigorously followed by anybody working in an MIQ facility or working at the border. So I'll now hand over to the Eliminator for the daily update on COVID cases. After that, we'll be happy to take your questions.
Thank you, Minister. Kia ora koutou katoa. So today we're reporting one new case of COVID-19 in a managed isolation facility in New Zealand. It's now been 88 days since the last case of COVID-19 was acquired locally from an unknown source, as we've reported previously. Today's case is a woman in her 20s who arrived in New Zealand on 14 July, originating in Afghanistan and travelling here via Dubai. She's been staying at the Distinction Hotel in Hamilton and tested negative around day 3 of her stay, but then at day 12, regular testing returned a weak positive test and has since been transferred to the quarantine facility in Auckland. Again, this case reinforces the rationale behind our approach of testing people twice during their stay. Most of the cases we are detecting in managed isolation are detected at the day 3 testing, but some people do not develop the infection to a point where they will test positive until later in the incubation period, and so we have the day 12 testing, and a negative day 12 test is a requirement, of course, for being able to leave the facility. One previously reported case has now been considered to have recovered, so our total number of active cases remains at 21. No one amongst those cases is receiving hospital level care, and our total number of cases is now 1,207, and we will report the additional case to the World Health Organization. On the testing front, yesterday our laboratories processed 1,107 tests, of which 872 were undertaken in the community. The balance in managed isolation and quarantine facilities. The lower number in managed isolation and quarantine reflects the lower occupancy rate at the moment in those facilities, and it's been good to see that the number of people being tested in the community has definitely increased over the last week or so since we've done that work with the colleges. Which brings me to the survey that the College of GPs sent out to members last week. For a 48-hour period, they got 800 responses from GPs and nurses around the country working in primary care. Some very valuable information on what the issues were, if any, that practitioners were facing in terms of delivering testing, and also any decline of testing and what the reasons were behind those. It's a very useful gauge of the public response. Generally, about half of GPs said that pretty much everyone they were offering a test to was accepting that, and that's encouraging. But there was quite a range of declines, so around 10% of GPs said nearly everybody was declining the test. The introduction of the option of a throat swab has increased the uptake, which is good, and there was also feedback around ensuring that we are clear about the payment for GPs for doing the swabs that we will again pick up with the district health boards, and they commented on the value of having planned clinics either in dedicated facilities or in their own practices, because the issue of donning and taking off PPE during the day if they're testing people who come in more randomly during the day is much more of a challenge. We'll continue to work closely with the College of GPs, other colleges, primary health organisations and district health boards to work through some of the rich information in that survey to make sure we are making it easy for both practitioners and for people who are being tested. And finally, on the NZ COVID Tracer app, we have 620,500 registered users. There's been 1.583 million poster scans, and again, please, an encouragement to everybody who hasn't downloaded the app to do so. We are in the process at the moment, as a precautionary approach, as the Minister's outlined, of doing contact tracing. The value of the information on the app cannot be overstated, including us having up-to-date contact details of people, but also people having ready access to a record of where they have been over the preceding month or so. Thank you, Minister.
Happy to take your questions. Yeah. I haven't had the latest numbers on the number of contacts that they've had. Their first priority, of course, was the people who would be deemed to be close contacts, so the rows in front and the rows behind. So they would have been the first priority, and then the contact with the others on the plane is simply to alert them so that they can be aware that there was a case on the plane with them. I'm happy to get you, I don't know whether the Director General has an update, but if we don't have it, we can certainly get it to you.
The numbers I received, thanks Minister, just before coming down was the total number of contacts at the moment is around 170. That includes those on the flights and in other settings. And we have, all of those people have had an attempt at contact. The vast majority, that conversation has happened. And of the people on the flight, Auckland to Christchurch, who are considered possible close contacts, remembering we have nothing yet that confirms this person was infected or infectious in New Zealand, but the ones who we're considering and treating as close contacts on the flight, all but one has so far been spoken with. Obviously there were the 5 people who the person was staying with over the period of time in Auckland, and they've all been actually interviewed face to face and are being tested today.
The woman who absconded a managed isolation facility in Auckland has pleaded guilty in court. The authority is aware of any risk of her absconding before she went into isolation?
Look, I think, as I've gone through many times before, these are hotels. They're not maximum security prisons. Up until the point that they arrive at them, people have not broken any laws. They are New Zealanders coming home, and we have to work on the presumption that they're going to follow the rules and do the right thing. Those who break the rules, as we've indicated, there are consequences for that. Now, I'll be very, cautious about commenting on something that's before the courts, because there's still issues of sentencing and so on that will be involved here. But our overall message to everybody is follow the rules and look at the numbers. 30,000 odd New Zealanders have returned through managed isolation and quarantine, and we've had a handful of issues that we've been dealing with. The vast majority of people coming through here are just New Zealanders coming home who are doing the right thing, and I thank them for that.
How many others are facing charges for absconding managed isolation?
Look, only the ones that have been in the media. I'm not aware of any that haven't already been well canvassed in the media.
On the community testing going forward, you've had this feedback now on some of the difficulties. Are you confident you can get it up to 4,000, or have you done as much as you can?
Look, that work is ongoing. Obviously, the current testing rates are not where we'd expect them to be. We do expect that there'll be day-to-day fluctuations. And if you look at the history of COVID testing since we started it in New Zealand, numbers drop off in the weekends. That's, it's like a heartbeat graph. Every weekend, the numbers have dropped off. And they do tend to peak at midweek. And so, but the numbers overall, the rolling average, which is the one that we focus on, isn't at the level that we'd expect it to be. And I know that Health, the Ministry of Health and the Director General himself actually have been working very, very hard to get underneath that, to understand what's the impediment to getting those numbers back up again. So they're not where we need them to be, but we do need a little bit of space to give them the time to do that. Extra guidance was released last week to help get those numbers back up again. So we need to allow that a little bit of time to flow through.
But the week after you became the health minister, you said that you hoped you'd be able to get those numbers up within kind of a couple of days or a week. Has it been harder than you expected?
It's been frustrating, that's correct. The numbers aren't at the level that I expected them to be and that I would like to see them at. I don't think there's any lack of willingness by health to push into that and to try and get those numbers back up again, and I have confidence that they're working very hard to do that.
Who isn't willing then? Whose fault is it that we've got such low testing numbers?
Look, there are a variety of factors there. I think that the Director-General just went through the work that they've been doing to really understand that. Is it that people are refusing the tests? Is it that GPs aren't doing enough tests? All of that work is being done by the Ministry so that we can understand that better. I don't think in any of this that there's a deliberate attempt to suppress testing numbers. I think that there are a few systemic issues that, as they're identified, we can work through just to make sure that the testing gets back to the level that we need to see it at.
If we had a community outbreak tomorrow, what planning, if any, is there for mass masking in the community?
That is one of the things that the Ministry are working on, and we've had a conversation about that yesterday, in fact, about making sure that we've got a stock of masks available. How we distribute them, and those are issues that we'll work through. How they'd be distributed, who would pay, those sorts of things are things that we will work our way through. But contingencies are being put in place. The Ministry do manage, on behalf of DHB, significant stockpiles of PPE. That's primarily targeted at the health workforce, of course, but we've got a role to make sure that we've got a stockpile there so that if we need to undertake public distribution, we can do so. Going back to our alert level framework and the announcement the Prime Minister and I made week before last, where we talked about the scenarios in which we may escalate. The most likely scenario is that we'd be talking about a geographical area rather than the whole country.
We've been told by bus drivers picking up recent returnees at the airport, greeting passengers with masks fitted around their chin. We're also seeing multiple situations where staff at managed isolation and CBACs wear masks on their chin or necks while outside. Is this how the Ministry of Health is recommending masks be worn?
Well, I'll let the Director-General comment on the use of PPE. I can tell you, though, that from my own visits to managed isolation, quarantine, and to the border, where I went at Auckland Airport, I saw people being very, very cautious in their overall approach to infection control, to wearing their PPE correctly, to sanitising when they need to. I didn't see any evidence of people not following the rules. In fact, all of the staff that I spoke to, and bearing in mind my visit was not announced to any of these facilities, all of the staff that I spoke to were very, very conscious of the matter. I'll just see whether the Director-General wants to add to that.
Thanks, Minister. Two comments, and one relates to the prior question, which is pertinent to the testing rates. We are still continuing to see, of course, our influenza-like illness rates are less than a third of what they usually are at this time. So the number of people with symptoms who are presenting to either ringing Healthline or presenting to general practice, who then could be offered a test, is much lower than it would normally be. But what we also do know is, and it's important that we do encourage people, if you are offered a test, to be swabbed, because it's an important part of our testing. And just to go back to your question, I mean, there's been very good guidance on the Ministry website right from the start of this pandemic around how to use a mask correctly, and people I can refer people in the general public to that, and of course all our staff working in managed isolation, quarantine, and at the border receive training on how to use not just masks properly, but how to hand wash and or use hand gels appropriately, and to even take gloves on and off appropriately.
Back on the South Korea case, forgive me if this has been mentioned, but what was the time frame between the person arriving in Korea and being tested for COVID-19?
I understand there are a couple of days, but I did have that. I did see that last night, and I know it was a couple of days, but I just don't have the exact time frame. I don't know whether you've got the exact time frame with you.
So the information I have, Minister, is that the person the test was done on arrival, and there was a gap between when that test was done and the result found, and when we found out about it in New Zealand, actually incidentally, and then contacted our national focal point counterpart in South Korea, which was on Saturday morning, and since that time we've had other conversations, but we've also geared up the response we needed to do. By yesterday, we still weren't sure, we hadn't confirmation a second test had been done, so we have initiated our actions as if a second test has been done, it's positive, and we're taking all steps.
I do want to reiterate, this is not the first case that we've dealt with like this. So we have had another false positive previously from someone who left New Zealand where they got a false positive on a rapid test, and the PCR test that was conducted 24 hours later, which is the standard test we use in New Zealand, was a negative test.
While in the US, they spent quite a lot of time here?
No, that's not known, but it is helpful to know that the person was in the USA, arrived in New Zealand the 18th of March, spent some months here, and has just left the country to go back home to South Korea.
Doesn't that mean it's quite unlikely that they would have contracted COVID-19 in Singapore? Because there's only 6 hours between flying from Singapore to flying to South Korea. So the incubation period, isn't that generally longer?
Can I just make an observation here that there are a variety of different scenarios here that could be correct, and at this point we're still assembling information to identify which of those scenarios is the most likely. Having said all of that, we are still we're still implementing our response as if it was a worst case scenario, out of an abundance of caution. So as I've said, there's no evidence of community transmission, and there's the people that we have contacted thus far are all well, so the people in the household where the person had been staying are all well, but we are being very cautious and undertaking the contact tracing to give that certainty. We will understand more as more investigations are done about what has actually happened here, but it takes a while to piece all of that together.
Contracted in Singapore, granted that though.
It's absolutely one of the scenarios we're looking at. As you heard the Minister mention, the person was in transit for quite a lengthy period in a well-populated transit lounge in Singapore. So that's one of the scenarios. We are, as the Minister said, working on the worst-case scenario that the person could have been infected and or infectious in New Zealand. However, there's nothing from any of our testing. Remembering the person had been living in Auckland, where we've had some of our higher community testing rates over the last 4 weeks. There's nothing to suggest we've had no positive tests there. Our influenza-like illness rates remain low, lower than usual. Our testing, we've not seen people coming into hospital where everyone who comes in with a sudden acute respiratory illness is tested, as well as part of that just routine surveillance. So there's nothing to suggest that we have community infection here. So it's quite puzzling in that respect, but again, we're just being precautionary and acting as if this is a positive test from here until we've confirmed otherwise.
Okay, we'll come over to the back. Yeah.
Thank you. With those close contacts, where are you at with testing them, and have you had any of the results back yet?
So as I indicated, those tests will be taking place today. The advice that I've had is that they're taking place today.
Is there a second test from the South Korean authorities a more reliable one than that fast testing?
Yes, that has been requested, yes. And MFAT are working with their counterparts on the South Korea side as well around that.
Timeline on that?
No, I don't have a timeline to give you on that.
No, we don't have a timeline, and the testing of close contact is happening today, as well as the staff who were working at Christchurch Airport at the border a week ago when the person went through. They're being offered testing today as well as part of our approach.
Yeah.
Dr. Bloomfield, on another public health matter, I just wondered, as the country's top doctor, do you think it would be a good thing overall if New Zealand voted to legalise cannabis?
Well, I'm obviously a public servant, and it's the government that's made a decision to put that issue to a referendum. So we supported the government in that decision making, and that's now out to the public to vote on at the next election.
And what are your thoughts on whether it would be a good thing or not? I mean, you're one of the people that can give people advice. What health matters would you like people to hold in their heads when they make this?
Look, I think you will realise it's not appropriate for me either in my role as Director General or to articulate a personal view on this referendum, and I think you'd be aware of that.
I'm not asking you for a particular view, I'm asking you to talk about facts.
So there is very good information that is being provided on the Ministry of Justice website, which is the appropriate ministry that is providing good information to inform the public so that they can make the choice they want to make on the election day, on both that and the other referendum that's been offered to the public on election day.
Thank you. Ms. Hipkins, I can ask you as a politician, you previously said that you were not going to give a position until you'd seen all the evidence. You must now get a chance to see all the law and all the associated information. What will your position be?
I've made the decision that I'm not going to publicly articulate how I am going to vote. My vote is no more or less important than every other New Zealander's vote in a referendum like this, and I won't be seeking, one way or the other, to influence the referendum campaign. Because I think it is important in a referendum that New Zealanders make their own judgments, exercise their own views, and frankly, I'm going to spend my time campaigning for the re-election of the Labour Party. That's where my energy is going to be focused.
Is there any indication that this person had any contact with someone who had left managed isolation or quarantine in recent months?
No, we don't have any information about that. And one of the things we are doing with follow-up today with the people who this person was staying with in Auckland is to get contact details and permission to talk directly with the person as well, just to help round out the story. And again, get as much information as we can about their movements here. But a critical piece of information which has been highlighted is that follow-up test which we've asked the South Korean officials to pursue.
Directly with the person in Korea who has received a positive test?
No, we haven't, and there's a reason for that, because they are a South Korean's citizen, and so we have to work through the authorities there, and they are not in a position for privacy reasons to give us that contact information. We're working both that channel and the channel through the people who the person stayed with here in New Zealand to get permission to make that contact directly.
The ministry's advice for
Well,
months
let's-
has been that the unwearing a mask has been that the evidence for and against pretty much balance each other out. Has the international situation changed that at all?
Minister, you happy for me to look?
Yes.
So what's become apparent is that in certain situations, particularly where you have quite widespread community transmission and you are not using a lockdown type setting to prevent or shut off those chains of transmission, then masks can be useful, mass masking can be useful in certain situations. So we've gone back to our technical advisory group, some of the members of which we know have very strong views about this, like Professor Michael Baker, to get clear advice about who and in what settings. Once we have that advice, we will incorporate that into our overall planning, and as part of that, we will work out also, as the Minister mentioned, how people can access and how we can distribute masks to the general population, should that be part of our response.
Okay, over here. I've met, I think as I indicated, it might have been last week when I was asked this question, I did meet with them. They've been finalising their report. Ministry of Health have also provided me with their update on the implementation of the Virol report, which says that they have implemented all of the recommendations in the Virol report. There is still some further work to be done around making sure that we're stress testing the system, and we're working through that at the moment. I hope to be in a position to say more about that very soon.
If you haven't spoken to this South Korean citizen, how difficult is it to contact trace in New Zealand?
One of the things that we have been able to do is identify where they were staying in New Zealand, and then get in contact with the people that they were staying with, and that has given the contact tracing system a body of information to start working from.
So were they staying with the five close contacts? Were they family members here?
I don't know the relationship. I know that they were staying with 5 people, and those 5 people now are being tested today, and they have provided information as part of the contact tracing process.
You don't know they were. How is it that they were in New Zealand in the first place? Was it before the borders closed, or are they a dual citizen?
My understanding was early to mid-March was their arrival date in New Zealand.
Yes, so 18th of March, my understanding on a visitor's visa, we worked with Customs to get the arrival card. We got the address then of where the person has been staying. The people they've been staying with have been interviewed last night by a public health physician, and so we've got quite a lot of information. We also already had the flights and the manifests from those flights, so those are the folk who have been called from yesterday.
So it's quite possible that there's a fair amount of close contacts that you have no knowledge of because you don't know directly from this person who they were spending time with while in New Zealand.
Not as yet, and that's what we're seeking, working both those channels to be able to talk directly with the person. We have some information from the people we spoke with last, that the public health unit spoke with yesterday, and they're going back today to get as much further information as they can.
What was this person in Christchurch?
In Christchurch, they stayed overnight and in some accommodation, and then caught the Singapore Airlines flight the next morning from Christchurch to Singapore. We know where they stayed, and again, that's one of the places that we are following up in terms of possible close contact.
All right, we'll just do a couple more questions. So, up the back.
What would be your message to people who are refusing COVID-19 tests?
The same message I've been giving for the last couple of weeks. So our testing in the community remains a very important part of our overall response to COVID-19. We do not want to end up in a situation that we have seen all too frequently and in a growing number of countries that previously had this infection under control. And one of the ways one of the things that is most important for us to be able to avoid that is to find any infections quickly and act in terms of contact tracing and further testing. So I really do encourage everybody who is offered a test, it will be for a good reason, please do accept that offer. The opportunity to have a throat swab rather than a nasopharyngeal swab is there, although the nasopharyngeal swab is the one that we prefer people had.
All right, we had a last question over here.
Can you clarify for me whether you guys recommend managed isolation staff wearing masks on their chins or their necks?
Well, I think the recommendation from me, as it would be from everybody in health, is that they wear them according to the guidance that they are given.
So should they wear them or not?
Should they wear masks? Of course, they should wear masks if that's what's required for the circumstances that they are in.
So just back to the College of GPs, the 50% of GPs having people say no, they don't want tests, is that surprising?
It doesn't surprise me because we knew that anecdotally that was happening. I should say that of the 50% reporting that people are refusing, sometimes it's only 1 in 10, and for some of them it's most. So there was a very wide range of refusal rates, as it were. And I think the evidence over the last week shows that people have heard the message and they are taking up the offer because we have seen an increased number of tests being done in community settings.
All right, I promised the last question over here. Is there still a question?
Yeah, how many people are currently in managed isolation? Do you have that number?
Yes, it's sitting just under 3,000. I didn't bring the sheet down with me that had the exact number, but I can certainly get you the exact number.
Mr. Wood, though, has talked about passing about 6,500. So why is the system currently happening?
Look, I'll get you to. I think some of that's about planning for expected arrivals, but your questions are best directed to Dr. Woods and to Air Commodore Webb, who of course are managing that flow through. Thanks very much, everyone. We will be back on Thursday, where we're happy to take more questions. Cheers.